Okay, very excited to welcome everyone to Nava Labs Demo Day 6. My name is Brandon Caniff. I'm the product manager for the referral generator tool we'll be discussing today. So, first, a little bit about Nava, just to give some context of our organization that and the folks here in the room today talking to you. Nava is a public benefit corporation that works directly with government agencies to change the way people experience government services for the better. And we set up delivery teams to support government partners with a variety of different services, but some of our top programs being human-centered design, product management, full stack software development, and then increasingly moving into legacy migration and modernization. And within Nava, this team that built the tool we'll be talking about today is a part of Nava Labs, which is a philanthropically funded division of Nava PBC that prototypes policy and system changes within government programs and advocates for their adoption. So we're a bit like an R&D and innovation lab within Nava and always looking for more innovative and better ways to make structural and systematic change through technology and program innovation. So, as for the folks presenting and talking today, you'll be hearing from me, Brandon, representing product, Ryan, our design lead, will be giving a demo and sharing learnings. Then we'll have a bit of like a fireside chat conversation with Eugene Edwards, who's the Director of Workforce Advancement at Goodwill Central Texas, and who is our primary partner today. And then we'll close out with Michael Chen, our evaluation lead, to talk about how we evaluate impact and success when building more innovative 0 to 1 new tools like the Gen AI tool we'll be talking about today. So we do a bit of a packed agenda, but I do want to at least let you all know where we'll be going today. First, we'll be going through a project overview. We'll talk a little bit about the problem space, what we learned getting on the ground and learning from Goodwill's positionality. And then I'll talk a bit about how that led to the product vision and the main features and goals that we ended up going after. Then Ryan will walk through a demo. We'll share learnings. We'll have a bit of a talk with Eugene at Goodwill, and then we'll close out with evaluations and a Q&A. So quick plug for the Q&A. You can drop your questions into the Q&A tool in Zoom at any time. We'll be collecting them in the background, and then at the end, we'll pick through as many of them as we can. So feel free to drop questions whenever they come to mind as we go through this presentation. And with that, let's get into a bit of the project that we're talking about today. So first, kind of to set the stakes of to make it clear that this there's actually a lot more going on than just the tool we're talking about. The project is actually part of a larger program of building tools with AI to support caseworkers who help families navigate and enroll in assistance programs and obtain community resources. There's our open source tools. Nava Labs is building across multiple states and nonprofit orgs, all focused on giving caseworkers time back to connect with families and access benefits for community members in need. And this tool just being one of a suite of solutions we've been working on for the last year and a half or so. But for today, we're going to be focusing in on the third tool in the stack here, the what we're calling the referral generator, a Gen AI powered tool. The other thing I should mention about the program is that this program is in partnership with Goodwill, and it's funded by the Gates Foundation. So that'll kind of give you a little bit of sense of the kind of problems we're going to be going after. And we'll talk a little bit more about what that means for it to be funded through Gates. So to get into the project goals, we had two main goals based on our main partners involved in this particular line of work. The first one being to create a use for a tool tailored for Goodwill staff. that can access the best resources for clients from Goodwill, government, and community resources. And we also were trying to test our ability to create a custom Gen AI tool that's more valuable and useful than just standard Google search or ChatGPT. And we'll get a little bit more of that in a second. And the other, which is particular interest for our funding partner, Gates, was to learn how to scale Gen AI tools. They're particularly interested in how do we take these kind of newer technologies like generative AI that show a lot of promise and potential, and what does it take to like scale them up so that they can be used by, in this case, upwards of hundreds of different branches at Goodwill. So this kind of informed the way we built and the type of decisions we made with the features we ended up going after. To get a little more specific on the partners involved with this specific work, we have three main constituents to help us take this product from just an idea to a full-on pilot and people using it on the ground. First is our main pilot partner, Central Texas, who worked alongside us from the beginning to kind of co-design what this pilot might look like and what sort of features and benefits would be best for their case managers. And then second, to kind of begin to test the idea of scaling to multiple locations, we brought on Goodwill Keystone, who is our testing partner for scale to see if what we built for Central Texas is also going to work in a different context, such as providing referrals for Keystone, Pennsylvania case managers and their clients. And then finally, to think beyond just the one to two, but the two to many or all, what it would mean to scale across all of Goodwill. We've worked with Goodwill International as our advisory partner of kind of what it would mean to take this thing beyond the pilot stage it's in now into a larger nationwide scale effort. So just grounding a little in the work of and the phases of this particular project that we're talking about. This one was on a kind of a short and aggressive timeline, which kind of factored into the kind of tools and features we wanted to go after. So we kicked off this work, this particular tool in the summertime in July, where we got aligned with Goodwill on the work, and then immediately started going into what we call research and prototyping, where we started to get a sense of the problems that Goodwill case managers were up against and dealing with and some of the bottlenecks and pain points in their work. And from there, in the early fall, we really got into the weeds of building out a Gen AI solution. And we actually were able to pilot in November. So the product you're going to see is officially live. It's been piloting for a couple months, and we've been doing phased rollouts to more users, and even recently launching with our second location, Keystone, to see how it works across regions. And this project is, just so you know, it's not done yet, so we don't have all of our findings, but we are pretty close here. We're hoping to wrap up the work and have an official analysis and findings by March of this year. So, with kind of the program set and in place, I want to talk a little bit about the product vision of the work and the tool before we show you all a demo of what we ended up building. Yeah, and Aaron, we're going to get into that right now. Your question on what does referral generated mean? Yeah, so first, I just want to talk a little bit about the context of the problem space. So we're working with Goodwill Workforce Advancement, who Eugene represents, and that program is all about trying to help people either find better, more stable employment, or kind of help them go through the process of getting maybe that first job if they're in a place of need. And a key part of that work is also that they think holistically. So they're not just thinking about what does it take to get somebody into a training program or like the best job for their skill set right now, but they think about what else do they need to succeed in life and to support doing workforce advancement. Could it be resources around how to get transportation to that job if they need, they could have financial insecurity, which means they need food assistance as well. And so this is kind of a key part of their work and why it leads, it creates a scenario where you need to be able to manage all types of different places where people are at and different resources that might be applicable to them. So some things about the case managers that Goodwill works with is they are actually already familiar with AI tools, specifically ChatGPT, but it's just not like optimized and tailored to their specific solution, but they have some base understanding familiar with AI, which was kind of unique and interesting for working with this organization. Another thing about their work is that their knowledge work and the docs they need to make referrals and resources is scattered across many different areas. It could be in their SharePoint, Microsoft system, emails, word of mouth, flyers coming in for short-term programs, and it creates quite a slew of resources to have to remember. And then there's also a wide array of resources to stay on top of, from internal programs that they run and manage. They have updated calendars every month to government programs that they could be recommending people and all sorts of different community resources. So knowing that context, when we started looking at oh, get the slide to go. The certain tools, the tools they're already using, we found that though they provide solid solutions, they're falling short and still provided room for improvement. So one way to deal with a client in a particular scenario maybe needs a certain like legal services, is to just Google legal services in Austin, Texas, where CTX is based. But we found that that can be overwhelming and slow, and then also doesn't have the context of internal programs that Goodwill already has. There's just ChatGPT out of the box, but that also doesn't have the context of Goodwill's internal programs and can be inconsistent and can change as you use it. And then they've tried other solutions like Find Help and 211 that are resource aggregators, but they're not always as up to date and sometimes provide generic solutions. And what we see actually they rely on a lot ends up being just printing out large binders of like resources. So just having their own kind of personal encyclopedia of like a print deck of different resources for all the different type of scenarios they might have to run through. And then lastly, just relying on their own memory and knowledge that they built up over the years of working with clients in all sorts of different scenarios and need. So knowing that landscape and the solutions they have had already thinking about, oh, and also this is just a call out. This is just a menu of the different resources that they might have to keep in the back of their head when they're working through the clients, from their own types of internal programs like GCTA and Google services to community resources across a variety of categories, government programs, and employment sites. But with all that context in place, we came up with what we thought like three main value props for the tool that we thought would be helpful. One, we wanted the tool to be able to give time back for coaching career planning. So when they're meeting with their clients about their particular scenarios that they're working through, it's less about spending that time researching and trying to find resources and more about how can we action on those resources and what sort of like psychological barriers are getting in the way of their client being able to actually move forward and in action on the resources that have been provided. We also wanted resources that move clients towards jobs, which, since that is a key part of the workforce advancement program. And finally, and you'll see this with a lot of Gen AI tools, confidence in every recommendation. We want to make sure that the tool is loaded with the resources that are relevant and trusted, and so that they know that they can trust the resources the AI is providing are actually useful and something they can provide their clients. So with all that research in mind, we came up with like kind of two main features for this tool, this referral generator. First, the bread and butter is this actual referring feature right here. So tailored resource referrals in a generative interface. So the keywords here being resource referrals, which means the caseworker, case manager working with the tool can provide information on what their client's going through, maybe the type of job programs they're interested or the type of assistance they need and their location. And we're going to provide the tool is then going to ingest that and provide a list of resources, as you see on the left here being two different rental assistance resources, and done in a generative interface, which means that we're generating a unique UI that's tailored to be easy to read and to fit the specific needs of the case managers. And second, we created this feature called Action Plans, which allows you to then act on the resources generated. So the tool is going to generate a bunch of resources that we think are relevant. You can then hone in on a couple of those resources, and then it creates these nice action plan cards that help you make sense of the resource and help them guide their clients through how they might actually action on this. So in this case, you've seen an example here for like emergency rental assistance. how to apply for that program, the documentation that will be needed, the timeline to expect after applying. And then one we found particularly helpful for folks has been the key tips part of the action plan, which provides like an extra kind of like a pro tip on how to use the resource. So we've seen like for food assistance and food banks, the pro tip might say, hey, you might want to arrive at the food bank before 6 a.m. because that's when they tend to start running out. And we find that to be particularly helpful for people. But with that, I want to kind of move beyond just the theory, the research, and the plan. And I'm going to pass it over to Ryan to actually show how this tool works.
Great. Thank you, Brandon. We're excited to show the tool today. So we have two short demos to show how it works, and they will be using this, they'll be recorded demos from the same tool the Goodwill case managers are using in our pilot, which is running as we speak. So the first scenario we're going to walk through is one focused on finding external resources. So we can put ourselves in the mind of being a case manager and we're working with a client, and their primary goal might be to become a medical assistant for a career, but they're also interviewing for jobs in the meantime, and they need clothes for job interviews as well as diapers for their child. So we're going to walk through that scenario in the tool. And I will narrate as we go. So here we see the homepage, all about just entering in whatever information might be useful to find the most useful resources or referrals for the client. And there's a few ways to enter in information, all designed around the idea of, I think many of us on this call have probably gone to ChatGPT, seen the empty prompt box, and have sort of blanked out in our mind and can't really think of what we need to put in there. So here we're adding a bit more structure there. Of course, we have the what kind of resources is your client looking for text box. Then we have location, where you can use zip code, city name, neighborhood. You can even just type a landmark to find resources near a hospital or something like that. And then resource categories to filter based on needs, if that is useful for the search the case manager is doing. And then lastly, sometimes the case manager might want to only look at programs Goodwill offers. Sometimes they might not want to see anything Goodwill offers and only government or community providers. And so you can choose to use or not use any of these additional filters with every prompt. So here we're going to type in what this client is looking for, which is medical assistant training, clothes for job interviews, and diapers. And we're going to do a location as well. They're in East Austin. And then we're not going to do resource categories for this search. We're just going to look at what is out there. So now we are on the results page where we'll see resources start to stream in. So here we'll see a couple medical assistant training programs. And the part to note here is that all of that description text is generated for the context we have already given the tool. So if we mention something about availability or transportation or certain focus area for a client, it could be reflected in this description since it's rewritten for each search you do to surface the most useful information. So we have Austin Community College Medical Assistant Program, Career Institute Medical Assistant Program. We have Dress for Success Austin, which has interview and work clothing. And then we have two options for diapers through the Diaper Bank partnership in the Austin area. So as the case manager, we would talk with our client about these resources, see if any of them are especially relevant, and decide which ones we want to make an action plan about. So in this case, we're going to make an action plan for ACC's Medical Assistant Program and Dress for Success, and Neighbor to Neighbor for the diaper offerings. So those listings have good information, but they don't provide too much more personalized guidance than something like a 211 or a Find Help or a Google search. So the action plan is where we really use the power of an LLM, large language model, to make some more guidance around how to actually access these resources and put it all in one place, as opposed to going to 3 or 4 different websites. And generally, they're all going to follow the template of how to apply or how to access a resource, the documents you need. They will have website links so we can go check out the source material, double check things, make sure it's all accurate, or get more information or an application form or request info. And then we'll go back to the action plan. We'll see documents needed, timeline, and key tips, which are just kind of any additional information that really might help someone avoid not getting access to a resource. And it will repeat for each resource. They'll tell you, classes fill up. If the current semester is full, you could apply early for the next one. Just additional guidance that might be relevant for each resource. So here we have one for the work clothing, similar format with links to their program. A key tip to note that they serve all women and have no income or referral requirements. And then similar set of guidance for the diaper bank, which it notes they are appointment only, which would be useful if it helps someone avoid walking up to that building and being told they need an appointment. Okay, so to complete the loop, again, we're a case manager talking with the client. We might have this up on our own computer screen. It's only useful if the client can actually act on the information. So in this version of the tool, we offer email and printing resources, and we can choose to share the whole page with all of the referrals or just the action plans for the ones we filtered down to. So we're going to do the action plan only. You can see a little recap of the resources with their contact info, and then the medical assistant and all of this action plan content we're looking at. So that completes the loop of the interaction for the referral tool. So we are going to just show a little bit more about how that same sort of workflow goes beyond just external resources and actually works with information at Goodwill as well. And this one will be the same flow, but in this case, that client who is working to become a medical assistant, they were looking for a job interview clothes. We might want to know what Goodwill job postings are available at the retail stores. And Goodwill Central Texas also has a lot of career advancement training classes. So we're going to look for the CAT, career advancement training, for budgeting. And the interaction is going to be the same. We could have added this to our original search. We just kept it separate for clarity's sake. But we should start to see a lot of blue colored Goodwill resources pop up for a lot of different retail and e-commerce processing jobs with links to job postings to just get the set of resources that might be especially relevant to a case manager who often do refer clients to job postings at Goodwill stores. So there's going to be a decent set of retail jobs. There's, I think, 93 job postings for Goodwill stores right now. It's not going to show all of them for this search, but we'll have a set of those to look through. And then there should be one posting here, number 11, for the budgeting class for the career advancement training class. So we could, same interaction flow, talk to the client, see which job postings or which classes make the most sense for them. And again, this is a separate search, but we could have had everything we searched for in that first round included here. Really think the blending of resources is a big value add here, again, compared to going to a different website for job postings, different website for community resources, et cetera, et cetera. So with that, we have the full loop. I'm just going to restart slideshow to get rid of my browser window. Okay, so we've shown the loop. It is pretty straightforward to find resources, decide which ones you want an action plan for, and then share them with your client. And as I said, There are currently case managers in Central Texas and Keystone, Pennsylvania, trying out exactly the tool I just shared. So we will have more findings when we're done with our pilot, and Michael will talk about how we're evaluating what works, but just a few emerging trends as we're hearing from people using the tool. The first one is that idea of combining sources from different places, generating action plans for guidance. We are seeing good signal that case managers see the value in reducing time spent looking for resources and then being able to personalize to each client, with the action plan or with the information they type in their original prompt. So here we have a quote from a case manager on the side about saving time, saves clients time. The results come in, I can pass that on, and it's being able to tailor your search to get resources that you need for your clients. So at a high level, people seeing the value in saving time, personalizing information, and reducing the number of sources people have to go to. On the flip side, what we also hear is that a tool like this really needs to feel like a natural fit in a case worker's or case manager's day-to-day work. So we have a sort of mock-up screenshot of referrals in a case management system. Goodwill uses something called Caseworthy in many regions. Different organizations have similar versions of this type of software. But right now, in our pilot program, staff have to remember our tool exists in a SharePoint page in this case. They have to decide it's appropriate for the client. So that client who is looking for medical assistant resources, I would have to decide, oh, they're a good fit to try out in this referral tool. Then I have to go outside of the normal case management system to find it. Then I have to get those results in the other tool. And then if I'm documenting anything, I have to go uh, back to this original case management system and sort of redocument anything I shared with the client. So lots of opportunity there for this and all AI tools to feel like a more natural fit into their day-to-day work as opposed to something separate. And this is a trend across a lot of our projects. Lastly, we didn't talk too much about how this tool is structured. We might have follow-up resources or demos about that. But at a high level, we are giving the LLM an OpenAI model in this case, but it could be any LLM. Access to a web search tool. So it has information on the internet. It can pull resource information that's more up to date than if you had to give it PDFs of everything, for example, which is very useful. This tool couldn't exist without that capability, but we are also learning that doesn't replace the knowledge management work that's required to keep a tool like this going and improve it over time. So many examples here, but the screenshot on the right side of the screen is a document we have to give the tool more context on those career advancement training classes that I mentioned in that second internal search. We also find it's useful to give it more context about information it could find on the internet just to make sure it has the full context and doesn't, only do 5 web searches and it would have found more useful information on the 6th web search. So giving it more context about internal resources, high priority community resources, we found is useful just to increase the quality of results. Okay, so we're learning a lot. Our pilot is going as we speak. We've heard a lot from the Nava perspective. So now we want to have a little bit of time to talk with Eugene, who is the Director of Workforce Advancement at Goodwill Central Texas, has been a great partner with us so far. And we're just going to have a small sort of fireside chat about how the project has been going so far. Great. All right, looks like we're both spotlit for people. I see a lot of Q&A coming in. Thank you for those. Keep them coming. And we'll get to those near the end. But Eugene, can you introduce yourself and tell us about your role at Goodwill and the case managers you support?
Absolutely. So I'm Eugene Edwards. I'm the Director of Workforce Advancement. I've been with the organization now for 14 years. Actually, I started out as a case manager myself. Our case managers primarily work with individuals seeking employment, training, or education. That's our primary purpose. So folks will come to us and need But often they hear through word of mouth the support services you mentioned, the holistic component to our service delivery model. You'll hear a lot of people come to us just for that, right? They find out, hey, you helped my friend with their rent. And so, although everything is tailored around employment, accessing resources is a key piece, right? People have barriers to employment, so we want to mitigate those barriers as much as possible. And this resource tool helps us with that.
Great. And in terms of this tool and AI tools in general, what do you think is the main kind of motivation, or why is Goodwill interested in exploring AI tools for career case management?
For sure. So I'll start off by saying we have relatively new senior leadership, right? New CEOs, et cetera. And they come from a background of technology. And so they've been pushing since they got here that we need to join the rest of society, right? We need to get more into the tech world. And so we started actually in the retail world with AI, and we have some really cutting edge retail AI stuff that we got going on. But we wanted to expand that too, because ultimately our mission is to serve the folks in the community. So how can we use AI tools to make the lives of our case managers better? They have large caseloads, right? A lot of people coming to us for support. Be able to serve 40, 50, 60 people on a caseload, you need to be efficient, right? And so tools like this is what we need so they can continue to serve, at high capacity.
Yeah, and kind of extending on that, there's new tools. Staff might be excited to try it for some reasons. They might be less excited to use it for others. From your perspective, what do you think encourages staff to adopt a new tool? I guess specifically in the AI world with this one, what encourages them and what are the barriers to adopting it?
Yeah, so the concept of it being a resource or referral guide is especially helpful for new employees. When you come to work at Goodwill Central Texas, it doesn't necessarily mean that you know all the resources available that in the community. And so something like this accelerates their knowledge really quickly, right? I know when I first started, like I had to like make phone calls and look around and ask questions of my peers and people that were veteran employees, like where do you go when you have a need in food security or whatever it might be. So this really helps bring and onboard people much faster so they can serve their clients, from day one. So what was the second part of the question?
What encourages them? So I
Oh,
think we covered
encourages
that.
them.
And then what are the barriers to
Yeah, so
that?
the main encouragement is like again this idea of efficiency, right? For a veteran case manager with a large caseload, how do I serve this person faster so I can get to the next client and serve them faster? So that is the main encouragement. Of course, as the culture in general we're pushing more and more the use of technology as well. So that's really helpful. As far as barriers, going back to the idea of your veteran case managers, they already have a routine
Yeah.
in place. And so it's really hard to adapt to or adapt to a new routine. They already know what resources they like to use that they have trust in. So it just takes time for them to have faith in this new technology and that it's going to serve their clients as well as they know they can serve them.
Great. Yeah, that is something in all of our labs projects is a lot of value to people new to a role or to a context to get up to speed really quickly. Um, let's see. So kind of taking a broader look for the general field of making generative AI tools like this for case managers, what would you like to see more of in that space?
We already are, supporting folks with trying to make their work more efficient, effective. We could continue down that path. So I could see something like this where they find the resource, they create the action plan, but then we can use AI to create the documentation that they need, right?
Mm,
Develop a case note based on what information you're sharing and put that in the system automatically for them. If we could get to a place where we're eliminating a lot of the administrative components of their work, they can spend a lot more time with the human element.
yeah, yeah. I think when we started, we had a dream that we could take intake forms and kind of extract information and then proactively suggest resources. And then the case manager could choose which ones to share and then kind of turn that all into a case note for people. So
For
hopefully
sure.
that vision will happen someday. Lastly, just in general, is there anything else you hope comes out of projects like this?
Yeah, I mean, ultimately, one, it helps me as a leader get a better sense for what's out there in the community instead of just kind of surviving in my silo of workforce advancement. It broadens my scope and allows me to bring this to the rest of my peers and the rest of my staff so that we can, better serve clients. Ultimately, that's the whole point, right? We're here to serve the community. And if we can do it better, why wouldn't we try?
Great. That is a fantastic line to end on. So thank you, Eugene, for taking the time to talk with us today and for being such a great partner through the whole pilot. We're excited to, you know, get to March, see where we're at in terms of the tool and share what we're learning.
Thank you so
So
much.
thanks. All right, we'll do a quick time check. All right, we have about 20 minutes. We're gonna try to save some time for Q&A. I'll say ahead of time, if we don't get to your question while we're talking, we will follow up with you to answer. But before that, we have a little bit evaluation from my partner, Michael. So Michael, you should have screen control now. Let me know if you can't advance slides.
All right, great. Thank you so much, Ryan. And Eugene, it's always it's inspiring to hear about stories, I think, from how our partners and colleagues at Goodwill are reacting to this tool. And as we collect more data, through these surveys and interviews, it's really great highlighting opportunities for us to figure out how we can make it better. So thanks for making time to be part of this. And yeah, so we're segueing into the evaluation component. Just want to spend a couple of minutes to, in some ways, set up a preview or a teaser for what's to come. And as Ryan and Brendan mentioned in the beginning, the pilot is currently mid-flight, and so we're sort of setting the stage for a future story that we're going to tell for, trying to understand what works for whom at Goodwill Central Texas and also at Keystone in Pennsylvania, and also just sort of under what sorts of conditions would this type of Gen AI tool be most valuable for caseworkers. So broadly speaking, we are interested in sort of these two major bins when it comes to impact or human evaluation, right? Right at the forefront, we want to know about implementation fidelity, right? We built this tool, we had this plan to roll it out. How much of it did that sort of get fulfilled or come true? And a big sort of subcomponent of that is trying to understand, how do these case managers with busy schedules and cognitively and emotionally demanding tasks, how are they reacting and perceiving to this technology intervention? And so, part of our exploration is to try to understand their perception, their take up, and ultimately their adoption and repeat usage over time. And then related to that is sort of this second major bucket, which is like, how is this tool helping the helpers, if any? And so there's a couple domains that we've sort of been consistently trying to assess over multiple pilots. So these are, as you can see here on the slide, we want to understand their administrative burden, their experience. How are they using their time? Does the AI tool indeed help optimize their efficiency, allow them to see perhaps more clients, or maybe being able to get through appointments more quickly. And we also care about, job satisfaction and burnout. So, does this resource enable caseworkers to kind of stay in their work or stay in their role longer and feel like they're valued, that they're contributing something as they help the community? And then we're also curious about their attitude, just about AI use, particularly in the nonprofit and public sector. And so we want to know about their beliefs, their attitudes, and whether it might be changing over time. So the way that we've approached this particular evaluation or this particular pilot is working closely with our friends at Goodwill Central Texas. We essentially rolled out a randomized control trial with a couple clusters, right? So you might have heard this described as a phased rollout approach or a step wedge cluster randomized experiment. And so essentially, we've got 48 case managers and we are randomly assigning them into three groups. So if you look at the figure on the slide here, the blue represents case managers in a particular group that have access to the tool. And then the light yellow represents case managers that are in groups that are serving as controls. And when we say controls, it basically just means they are maintaining their status quo workflow. They don't have access to that SharePoint page in their system, which is where the referral tool lives. And ultimately, the purpose of having a design like this is so that we can try to better understand sort of the causal impact of this tool, right? And then to give you a sense of like, what is it that we're measuring, and a lot of this, will come as no surprise because they are directly informed by what Eugene has identified as, priorities or curiosities, and also what Ryan and Brandon shared earlier. The long and short of it is that we typically take, and in this case, indeed, it is our approach that we use a combination of quantitative and qualitative methods or analytic tools to really try to tell a comprehensive story about whether and how this AI tool is helping case managers. And so I won't read every bullet on this slide, but just to say we're looking at sort of four broad buckets, right? We're looking at product metrics that get collected in the background as case managers interact with the tool. We're also actively collecting data through periodic surveys and some of those domains I mentioned earlier. And I think one point that's worth emphasizing is that whenever possible, we try to incorporate validated measurements. So, scales like the administrative burden scale, there's also a trust in AI scale. So we try to incorporate those into our assessments so as to not reinvent the wheel. And also it gives us some sort of comparison to other work that's being done by other researchers or other technologists. And of course, just as importantly, we're continuing to collect qualitative data through both advisory board sessions with case managers and also with clients or consumers. And then what we have coming up as the pilot wraps up in the near future is we'll be doing some deep dives with case managers to really try to understand, we can look at the prompt that they submitted and try to get into their heads a little bit and understand what is it that they were seeking at the time. And then how was the output helpful to them, or maybe it wasn't. And so, these qualitative semi-structured interviews will give us sort of further context as to how the tool may be adding value or not to their engagement with clients. So, like I said, that was sort of a preview of what's to come, and hopefully in future demo days, we'll be able to share eval findings from this randomized experiment. We're going to pivot to the next sort of segment of our time together here, which is Q&A. I want to encourage you to keep putting in those questions in the Q&A box in Zoom. Yeah, and I'll hand the time over back to Ryan.
Great. Thank you, Michael. And like Michael said, our pilot is up and running currently, and we will definitely be sharing more about all of our great evaluation work as we're getting to the end of our pilot. Okay, so we have a decent amount of time for Q&A, so we should get through a good number of them. We'll go through, some of them might get a typed response. There's one answered already, which I'll give a summary of, and then we'll go through some of the other ones, and either myself or one of my colleagues on the call will answer. So to start with, I noticed one got an answer from Genevieve in the Q&A already. Ryan's demo examples were both about the case manager using the search tool. How are we thinking about whether or why to make the referral generator accessible directly by people seeking services, so client access to the tool? And Genevieve is talking about how our goals with the program in the labs has been to evaluate whether there are responsible applications of AI and benefit navigation generally. So we made the choice to focus on the caseworker or staff perspective so we can have that expert in the loop. I think I saw another question about how we're evaluating resources and keeping them up to date. So by having staff in the loop, we can have them be sort of a filter to double check information and also a great feedback loop to give us more context on the use case. So yeah, avoiding inaccurate and harmful answers. And as Genevieve says, we are interested in exploring user-facing services in internal experiments. We're prioritizing safe caseworker-driven interactions for production work right now. Okay, so going down the list, what would need to happen to have this tool scale not just within Goodwill, but beyond Goodwill? I would think the LLM knowledge build and management would be distinct I assume, Aaron, correct me if I'm wrong, I assume you mean building the tool is one set of work and then scaling it to other contexts is distinct. Is that roughly 5% of the lift building it, or is it more like 75%? Does anyone from the Nava or Goodwill side want to take this one?
I can talk about it a little bit.
Go for it.
Yeah, so we had to start thinking about this when we moved from just making an initial pilot product for Central Texas, and then how to evolve that to make it work for Keystone. And then obviously from there, we kind of learn what the differences are, and that kind of informs what we take to go next. Yeah, I would say one of the key things, I think this was mentioned, one of the key features that we leverage for referral generation is web search, which is this ability for the AI to go on the open web and look for resources. And this tool has been, since we implemented, has been very powerful for flexibility. So it allows to, with just a little bit of context about the user and where they're from, be able to go on the open web and find like the most useful, relevant, and local resources. So this provides a lot of flexibility for it working in for some of regenerating referrals that are, it could be from the social worker or from natural like client user or from being from one location to another. And what it meant for us is to think for questions like what is the default location. So we built a cool tool for Central Texas. So right now, any answer, if you don't specify your location, it's just going to default to resources that are in that area. And so we had to then tailor a version for Pennsylvania. And to go beyond that, we'd probably have to put in some restraints for some way to make sure that we always get their location so that that's tailored. So, or make a default that's something more on the national level. So making a version that if you don't specify your location, you're getting resources that are maybe more government, the national level, and just more broadly accessible in that sense. So there's that piece, which I don't think is that hard and kind of just UI considerations. And then I think the next piece, when we talk about management, about resource management, we kind of go through a similar process to think about that. So we have a process for collecting resources and then collating them into a folder that we're constantly having the AI read for just having the latest suite of resources for Central Texas. And we did a different one for Keystone, Pennsylvania. And so to go at the national scale or just beyond Goodwill, I think the trickiness there would be you have to have a resource folder that would have lots and lots and lots of resources across the country. And I think the biggest issue to think about there would be the speed. And when you're setting up like a retrieval, a RAG system at that scale, that it might start slowing down the responses. So I think it'd be more of a technical architectural challenge and setting up in a way that like only parses the local resources the most relevant to speed things up. But that's some of the thinking to that we've been going through to go about like how do you go from a specialized version to more broadly making it useful.
Great. Thanks for that, Brendan. Okay, I think I can take this next one from Allison for an overview. The curation process of the resources, I can imagine caseworkers being really valuable for vetting valuable resources. And how are you thinking of scaling it? Definitely, case managers are a big part of this. I would say overall, the process we went through was defining trusted sources from case managers, so including external websites from government providers or 211 or Find Help as resource aggregators that they trust, as well as, like I said, government resources or big programs that they often reference. So getting that really a set of websites as a sort of trusted list for the tool to use. Second, it would be the same for internal resources. So what do they trust and use often? And then on the feedback loop side, it would be, people are trying out this tool right now. I think last week someone said, hey, I think it could use more information on women's services specifically. And so we have this sort of AI assisted research process, sort of like a deep research report, if you've ever used that feature, where it will go through, look for trusted resources in that realm so that the tool has that baseline and it can find more using web search when someone is prompting. The question of scale is an interesting one of how we're doing that because we can respond to people's requests individually. I know Goodwill is exploring some ways of having a database or just a spreadsheet in SharePoint where people can add resources, especially for seasonal ones, and have that be a source that the tool can use so it can look up things that might not be accessible for a long time or might not be accessible through a generic web search. So there's a lot more to explore in that realm, but that was a high level overview of how we curated resources. Let's see. Just want to highlight Mark's question to get to some different sets of questions. And it's a very interesting one. In the Chicago affordable housing world, we have a recurring problem where there's about 1,000 different waiting lists that often require active client follow-up to maintain a spot on the list, or they have waiting lists that rapidly open and close like over the course of a few hours. Have you thought through ways to address those system challenges short of changing underlying policies? Um, Anyone from the team want to jump in on that one? If not, I can go again. Okay, yeah, so I think the closest we've gotten to this are the job postings and career advancement classes, where those are web sources that are changing sort of day by day, potentially hour by hour. I will say I don't think we've solved the live updating question, but we at least have a process where we can look at a website and pull all the information from it so that our tool can reliably use that information. They're called web scrapers, if you're familiar with that. And it wasn't too much work to get those set up, and it's a good workflow to consistently pull information from a trusted source. So in a scenario like this, where it's really hour by hour, that makes me think of how do you go even beyond that to have live access to resources that are changing like that? And how do you notify people? Maybe texting a case manager or having an alert in their case management system is not something we've done, but I definitely see a world here where there's a need for that sort of live updating and live feedback loop. So I'd say we've taken a few small steps into that direction, but have not resolved that specific need. Okay, maybe I'll turn it to the team. It looks like there are 3 questions left. Does anyone have, from the Nava or Goodwill side, anyone have a question they want to jump in and answer? And then I think this might be our last one. And if we don't get to any of the others, we will reach out. And it looks like they're all from Aaron. So Aaron will get you answers to all of these, but anyone have one they want to answer while we're on?
Well, I'll try to answer the one about Goodwill specific resources. Uh, it was a very similar process to external resources, to be honest with you. We have our own internal documentation that we fed to, or we put in a folder for it to read from. But we also have websites that we can. I know that the Nava team actually kind of made adjustments to the back end to ensure that Goodwill resources got a different level of priority depending on what, the prompt that was submitted. But ultimately, it serves looks at it similarly, right? It can go to the Goodwill Career Techno Academy, which we have our class schedule posted, so it can pull data right straight from that website. And then it's on us to keep that information up to date anyway. So then it always has up to date information for the tool.
Yeah, great. Thank you, Eugene. Yeah, definitely much easier to keep resources up to date when they have a really well-maintained website like the GCTA with schedules and everything that are available for web search. All right, so I'm gonna share my screen one more time and wrap us up. So thank you everyone for joining us today. Just gonna say a little bit about what's coming next for this project. As we've mentioned a few times, our pilot is ongoing. It goes till the end of this month, roughly, and then we'll have analysis evaluation work in March. And because we have funding from the Gates Foundation, most everything we do is open source. So we'll be able to share what we're learning from evaluation and lessons learned about the tool. While we're doing that, we are talking with Goodwill, both Central Texas, Keystone, and Goodwill International to talk about that initial goal we mentioned up front of, okay, we have this tool, it seems generally valuable, especially if it could be more connected to people's workflows. What might it look like for this to keep going when this pilot isn't running and when the Nava resources to maintain it aren't working on the project? So those conversations are going on right now, which is a learning process for all of us about how do you go from pilot to quote unquote real use of an AI tool. And yeah, that's ongoing right now. So with all of that in mind, thank you again. We have a contact email, labs@navapbc.com. We have a newsletter. We have most of our projects have case studies and toolkits on navapbc.com/labs. And there are many other projects besides this referral generator with lots of good resources. And again, most everything we do in this program is open source. So you can, if you're technically minded or want to look at how these things are built, you can look at the GitHub repos for the referral generator we talked about today, the assistive chatbot, and the form filling assistant in our program. All right, so this session was recorded. It will be shared back out to you all. I believe there is also a feedback survey that you will be getting. You could share your thoughts. That is very useful to us to make sure these demos are useful to everyone who joins. So thank you all for attending. Thank you, Jean, for joining and sharing your thoughts and working with us. It's been a great project, and we're excited to share what comes out of it. All right. Thank you, everyone.